We'll kick off. Just a very, very warm welcome from me. I am Andrea. I am the slow coach. I am based in St Ives, just north of Sydney, and very, very grateful to all of you and to Dr. Greg Sher for your time tonight, where we're going to discuss running injuries. So welcome, and thank you very, very much for coming. Tonight's session on Runjuries is part of our Slow Learners series. Other sessions can be found on the Run with the Slow Coach website, and there are webinars that cover things like the importance of strength training, resilience and training in difficult times, the importance of mindset and more. And in the next couple of weeks, we'll also be bringing you some great webinars on Pilates for runners, navigating menopause and running over the hill, and the importance of things like shoes and sleep. But we'll get to more of about that later. In the meantime, I'm just going to tell you very briefly about the Slow Coach. The Slow Coach is a coaching service and a movement that I've to what I perceived to the need for a wider, more inclusive conversation about running. So much of the mainstream media of running is very, very fixated on things like getting faster, getting stronger, getting better, smashing a PB, and so on. Those kinds of words are really all the main headlines. And generally the imagery of runners includes a very, very specific body type, a very strong, invariably very young male or female who's almost always wearing a crop top and featuring a perfect ponytail. And now I take nothing away from any of those things. They are all amazing and they're all important. But I feel like there's more to running than just that. And that running doesn't need to be so predominantly focused around conversations about speed. For me, running is also an avenue to things like friendship and joy and personal achievement, and just time alone, time to think, and time on our feet. At the Slow Coach, pace is never our primary focus, and we cater to every goal, every level, and everybody. And very proudly, the Slow Coach has just been notified that we are a finalist in the North Shore Local Business Awards for 2021. So very proud of that, being a new business, only started late last year. For those of you who are local to St Ives, north of Sydney, we do train twice a week when we can on the St Ives Village Green. So if you'd like to join us, you are very welcome. Generally speaking, the sessions take place on a Monday at 6 and a Thursday at 9:15 in the morning. And we make sure that everybody can join in. That includes babies, children, dogs on a leash. We just incorporate them in the training. And as I've said before, running behind is for all levels and all abilities. But if you're not local to St Ives or group training is not your thing, we do also offer an online membership program.
Can you hear it now?
I think that I'm the only person in the world currently catering for slow runners through membership programs. So very proud of that. It's only $55 for a year. It includes a one-on-one consultation. I'm very proud of the community and support that we extend to all runners, our virtual members and our in-person members. The ground running membership will include some amazing discounts on races and gear and shoes. And whilst I haven't done the exact maths, I'm pretty sure that the savings alone on the recommended gear, races and shoes that you get through our memberships will more than cover your annual membership fee. It also includes a really specific knowledge center, which has been curated specifically for beginner runners, newer runners, older, slower and injured runners. Unlike most mainstream membership programs, which are very focused, as I said, on things like pace and speed and PBs, ours is almost the opposite. Very inclusive and very, very mindful of the beginning aspect of the running journey. Now, obviously, we can't train in groups in the moment, so I will mention that I do also offer one-on-one training for anyone who would like to train with me. I am a registered COVID-safe business, and I'm a level 2 accredited running coach with Athletics Australia. Your one-on-one training includes a very specific personalized focus. I will even create a running plan specifically for you if you have a goal to get to your first 5K race or 10K or half marathon or whatever the case may be, or if you just want an avenue to learn to love running. I will create something very specific to you that's very mindful of your own circumstances, the amount of time that you have to train, your family setup, whatever the case may be. I will take it all into account. And then once we are actually training, we'll do some strength and mobility work for about 30 minutes. And then about 30 minutes of actually running together. I'll run alongside you and I'll pace you. It's a bespoke training system, as I said, and one-on-one clients get access to all the available discounts that we offer to our group clients as well. But there are a lot of other benefits to the Slow Coach community. It's very strong and supportive. I think that runners are the biggest cheerleaders for one another. When we can, we offer a lot of what we call social runs. So with no emphasis at all on speed and lots of emphasis on fun and friendship, and especially on coffee. We get together and run whenever we can in a group. We also have a WhatsApp group where we support and cheer for one another and ask questions and answer them. You will also get access to this, our Slow Learners webinar series. And as I've already mentioned, some amazing partner discounts. So if you'd like to find out more about anything I've just said, because I know I did race through it quite quickly, you're very welcome to have a look at the Run with the Slow Coach website, or just email us and we'll be really, really delighted to help you. So that's the advertising out the way. Thank you for your time. It now gives me great pleasure to introduce Dr. Greg Sher. Greg achieved his master's degree in chiropractic at the University of Johannesburg, South Africa in 2002. He also set up practices in London and ran successful practices in Johannesburg. He was the chiropractor to the South African water polo team, as well as to a professional cycling team, Team TSN. His knowledge was formed through running a chiropractic and wellness program at BP in London, which is one of the world's largest companies. He has developed a really great understanding of the pressures that develop from sitting in front of our computers all day long, especially these days when we're all working from home. And he is very passionate about the importance of having correct ergonomics in the workplace. He conducts workshops at small and large corporations. He teaches the importance of sitting and standing correctly and helping people achieve an optimum position at their workstations. He's taught anatomy at the University of London. He's teaching clinical and applied anatomy to medical, physiotherapy, and biomedical technology students, and he has a thirst for knowledge that continues to this day. His special interest, though, is the chiropractic approach to sporting injuries. He has helped athletes like us, and many who are far faster than us, reach their full sporting potential for many years. He's also adjusted elite rowers, cyclists, water polo players, rugby players, triathletes, and runners to help them achieve optimum health and biomechanical function. So with that very impressive introduction and resume, it gives me great pleasure to introduce Dr. Greg Sher. Welcome, Greg.
Thanks very much. That was a very impressive sounding resume. It sounds like I wrote that one myself. So what we're going to do tonight, just to, I suppose, kind of give you a bit of an outline, is talk through just the general approach that we would look at as a sports practitioner, sports medicine practitioner, in terms of how we would assess and also what leads people to break down. We'll also highlight some of the most common injuries in specifically no particular order to what we see, because everyone comes in with a different injury and a different reason for the injury. What I'm talking about tonight is by no means prescriptive, but also it is not the end answer to anything. That this is very important. If you've got any concerns, we didn't put the disclaimer into the presentation, but if you've got any concerns, you should seek advice from a qualified healthcare professional. And if you are not local to us, I've got clinics within the CBD and Double Bay, Alexandria and Des Moines, so east and slightly west and in the CBD, so not necessarily anywhere near St. Ives. But if you're looking for help, and we're happy to refer and try and find a practitioner that can assist you local to your home. I think that's very important. Saying that, if there's anything that we can give you in terms of knowledge about why you get injured, help you make better decisions and choices about the approach that you take to your training, whatever that may be, then you can then also hopefully take a few corrective measures and learn from that tonight. Save yourself a lot of injury, but also hopefully some money. So with that said, what I'll do is share my screen and take you through the presentation. If you do have any questions, I think the chat will be available to you to ask questions, and then we will come back to those questions afterwards. So rather than stopping and starting, and also the, let me just see where the presentation is. I'll start the screen sharing now. So yeah, if there's anything specific that you want to cover that we've left off that we don't have time for tonight, you're more than welcome to contact me afterwards. So hopefully that's been said. I'm going to start the screen share. I've called my talk tonight, The Survival of the Fittest. And this fit concept is all about a relative thing. So it doesn't mean because you're a slower runner than your partner or than your child that you're less fit. Fitness is about the ability to perform and then recover. And obviously recover without injuring yourself, and then repeat. And this is the very important thing, is the rinse and the repeat. So these are my clinics here, and specifically any information that you would require afterwards. I know Andrea will send out the link afterwards, but you can contact Greg at sydneyspine.com.au. So tonight we're talking about running and not injuring yourself. So I know you're specifically non-competitive, but I'm pretty sure that there's some competitiveness within that realm anyway. And the important part of that is to actually push yourself to do better. Hopefully, again, not pushing yourself to do injury, but humans remain competitive, as you would have hopefully witnessed over the last few weeks with the Olympics. And we enjoy good competition. So that's an ostrich or an emu, one of the two, I'm not too sure, but they are fast birds. Now, who am I? As Andrea mentioned, I am a chiropractor. I have an undergraduate and then a master's degree in chiropractic, which I achieved in Johannesburg. But I've done advanced board exams and further study both in the UK, New Zealand to qualify into Australia. So I feel I'm well-traveled, had lots of practices, but still pretty much passionate with regards to what I always started chiropractic on, and that was the focus on sports. And I'm a chiropractor who loves treating sports injuries. Unfortunately, in Australia, there is no ability to call yourself a sports chiropractor. We don't have the ability to call ourselves specialized. That is being granted by an educational authority, and that's just started now. But I am a chiropractor who loves to treat sports injuries, so I'm certainly not a specialist, but I have treated a lot of sports injuries over the years. And I like to think of myself as a pretty average sportsman. I run, I cycle, and when allowed to, I go and do personal training because I do not enjoy going to the gym, but I very much value the importance of strength and being strong and prepared for my sport. I also play and played rugby, hockey as a kid, soccer as well. So, but right now I predominantly run and or cycle and do duathlons. So in our clinical approach, we see three main groups of athletes. Number one, the professional athlete. These are guys and girls that get paid to basically trade in their sport. They would get off their bike or get off the running or the tennis court and go straight for some form of treatment, for a debrief. They have exercise programs written for them. They are supervised through the gym, and they basically spend all day, 10, 11 months per year doing their sport, and then hopefully make a bit of money out of that. The next group that we would see is the high-level athletes. So these are the amateurs who are very good at things. For example, a lot of the Olympians who have to have full-time jobs and don't get paid from their sport, but like to compete and are able to compete at a high level. And so their injury needs are sometimes different. Again, if you're a part of an elite program, then that elite program would give you treatment, therapy, coaching advice. But for the most part, these are people that have normal jobs that then, or university studies, and then compete. And then the third group, which hopefully we're directing this talk at tonight, is the weekend warrior. And hopefully more of the picture on the left, the person crossing the line after a triathlon, rather than the person sitting in front of his computer with a broken arm, broken leg, and in a neck brace on the Monday morning. But unfortunately, we often see that. So that's what we're here to hopefully help you prevent. So I'll start with, how do we actually get injured? And this is where someone like Andrea, the Slow Coach program, is very good, and we'll talk about that later, is the progression. But we very often see too much too soon. So the amount of times I've had a patient come in who just they leg press a maximum of 100 kilograms, and then they've gone up to 130 kilograms or 140 kilograms in one jump and have gotten injured. And what they don't think about is that that's a significant leap up. So we're normally talking about progression in 10%. So don't progress your load or your time more than 10%, where you're thinking, well, 100 to 130 is 40, 50, 60%. And that's how we break down. So the too much, too soon, and improper progression. Then the next thing that often happens, so we've mentioned a bit about that, is the change in distance. So significant change in distance, intensity in the running, or the terrain. So having only ever trained on flat, then you go to do a hill climb, or the intensity where you're normally running at 7-minute kilometers, and all of a sudden one day you get a tailwind and you decide to run at 5-minute kilometers, and then you break down. And often with this sort of thing, you find immediately after the run, you then go and do another run and then break down after that. So it's often a cumulative load that we see, not immediate. And that's sometimes the problem, is that the feedback comes in only later. Equipment failure. So in running's case, bad, poorly fitted shoes, shoes that are not providing any support. And, so that's a very important thing. Or you have improper fit within the shoe, or the shoe is not right for the terrain. So for example, you are running in a minimalist shoe on a really hard piece of concrete and your body's not ready for that. In this case here, number 3, I will not get into barefoot running because we don't necessarily recommend that. That was a fad which some people have moved towards. If you did ever want to do that, it is a 2-year progression to change from shoes to barefoot. So it's not something we would recommend just doing. You need to seek proper professional advice, which is probably even beyond my abilities to actually give you without breaking down. So we're talking about people in shoes and properly fitted shoes. And one of the benefits of Andrea's program is the access to people who would fit you into a proper running shoe, which is very important. And that also leads us to the running shoe is only for running. You can wear it a bit before and all that, but generally you should not be walking in your running shoe because the style is different, and that can lead to increased mileage on your running shoe, so quicker breakdown, and running shoes are not cheap. And also it can lead to a change or difference in the wear pattern, which can force your foot into a place that it doesn't necessarily want to go. So that's an important thing to look at, is the shoe. A little quick tip with that is, if you've got the means, buy 2 pairs of shoes at the same time and then alternate your shoes. And I use Garmin Connect, and in Garmin you can actually have what they call the gear selector, and you can set your gear and you track how many miles you do in your gear, and also it can track which your last run was in which shoe. And if you've got the same shoe, maybe in a different color, what will happen is they'll just last twice as long, and then you don't have to worry about manufacturer upgrades and all that for far longer. So that's something I recommend, and I practice that actively. The nice thing with that is when your shoes run their course, then they become a nice pair of walk-around trainers for a while. And then the last thing with injuries is pathology. So if we've got an actual problem, Now, I won't spend too much time focusing on that in this slide because we will talk a bit about it later in terms of all the injuries, but everyone obviously is different. And again, point number 4 is where you do and should seek medical advice. So we'll start with some examples of the most common injuries we see, and I've specifically put them all into a random order. So number 1 is runner's knee or patellofemoral pain syndrome, often referred to as AKP or anterior knee pain, which is not a diagnosis, but it's just a broad description of where the pain is. Now, unfortunately, the knee is very complex. It's got lots of muscles around it, and a lot of structures can be irritated, but generally with runner's knee, as that generic term, is often caused by weak and tight muscles around the knee that allow the kneecap itself to move and track out of its normal plane. And this is important because it's like a train on improperly fitted train tracks that can cause irritation behind the kneecap, but also a little bit of swelling and muscular weakness, which will then further progress your injury along. So some cases you can have a weakness in your glute muscles, which cause your leg to rotate inwards, and that causes your knee to rotate. So we'll talk a little bit about the treatment, but that's probably the most common issue that we would see in clinic. Next thing, keeping with knees, ITB or iliotibial band syndrome. I'm sure most runners and probably most cyclists and triathletes would have heard of this or experienced this. Often sharp and pinpoint pain just on the outside of the knee. Often also both sides, but more predominant one side than the other, and would often feel it during activity. So for example, on your running, every time your knee hits the ground and then your foot hits the ground and your knee starts to straighten up, you get the sharp pain on the outside of your knee. And what it is believed to have been friction syndrome. And the latest research has actually been done on friction syndrome, which was a big issue around the thought was that it was the tendon rubbing over a bony prominence. That was when I was at university, I was taught, and that they used to then talk about using a foam roller and all that to basically get this strong tissue to roll it out and talk about relief and all that. But the latest research shows that this tissue actually, it causes compression of something just underneath between the bone and the knee, the ITB, sorry, the tissue itself. And what happens now is that the foam rolling will actually compound that at the knee. So that's actually officially the current recommendation in treatment is do not foam roll ITB. It's actually better to treat up closer to the hip rather than the knee. So that's outside. So in terms of management of ITB, the good news about it is it's not one of those injuries that's necessarily likely to just tear. So you can actually train through it within your body's tolerance and ability. With iliotibial band, people have better comfort with walking or running on an incline. So if you have a hill, although that's part of this issue with the progression in terms of changing your terrain, but if you've got a treadmill or access to a treadmill, obviously in COVID lockdown now, unless you've got one at home, you don't. But if you put it on a bit of an incline and walk, it often immediately takes the pain away because that decompresses the tissue, which is a very good thing. The other thing is, and probably one of the most important things long-term in strategy, is to strengthen your quadriceps, which is the muscles at the front of your thigh, your hamstrings, which is at the back, and the muscles that surround and work with your hip and your pelvis, in particular your glute muscles, which will help to prevent your pelvis from shifting side to side. So further on, we're going to talk about knees, muscle and tendon issues that can be thigh strain. So your muscle, you slightly tear your thigh muscle, your quadricep or your hamstring to an actual tear, or to tendinopathy, which is where the muscle attaches to the bone is called the tendon. And the issue with that is that if the tendon itself is not necessarily strong enough, it can start to degenerate and become not only weak, but also quite painful. It used to be called tendonitis. That is old old school language, because tendonitis basically is inflammation of your tendon. Tendinopathy refers to degeneration, which is the actual term that it is. And that changes how we manage them as well. So for you, for example, we'll talk about Achilles tendinopathy a bit later, but if you've got a tendinopathy, what we actually talk to people about is actually encouraging them to load it. So when I was a kid, my dad had Achilles tendon issues. He was told to take 2 weeks off running, and he was told to go and ice it and do nothing. And that management has changed. Now we would tell people to actually load the tendon with intolerance, which again should be managed by someone who knows what they're talking about, and someone who knows, possibly who's even experienced that sort of problem themselves, so they can understand where you're coming from. Well, knee joint, cartilage, and ligament issues. So your knee itself can get injured. Things like arthritis or arthritic change. Cartilage, so the meniscus, which is the cushioning underneath between the femur bone and the tibia, which can get slightly pinched or degenerated and caught, or the ligament itself, although that's not very common in runners. That's more of a footy injury where someone crashes into the back of your knee or that sort of issue. Now, I will say one thing at this point, especially focused on slower, older runners, is that people were told by their doctors they're not allowed to run anymore because of their knee joint, and they've got arthritis of the knee or the hip and they can't run. And look, each person has a case-by-case basis, but generally I do not agree with that language. I do not like when a doctor tells a patient they're not allowed to run. And that's a very generalized piece of information. And a lot of the research is actually pro-running more than not running for if you've got knee arthritis. The reason is, A, it's moving you, B, it's good for your heart, and C, and most importantly, it can diminish your body weight enough in terms of taking pressure off your knee joint that it actually, you end up ahead of the game, even if you run on it. So if you're putting load through your knee and injuring it by being too heavy on your knee, the loss of your body weight actually compensates for that and gives you more back. So I'm here to highly encourage slow progression of running. And again, listen to your body. If it's painful, then you need to back off. But if it's not painful and you can do what you need to do, then I think it's a highly, highly beneficial form of training. So I'm very pro. So the issues with muscle, tendon, and knee joint, cartilage, or ligament are often caused by too much training, so overloading, or changing terrain, or increasing the intensity too quickly. So again, it's all about slow progression, allowing the muscles, the bones, and the ligaments to all strengthen up. Okay. Next in is ankle. So ankle sprains are relatively common, very much so in South Africa, because people run on the road in South Africa and the camber is quite deep and can sprain their ankle there. And also running on the footpath in South Africa, if you don't fall into a giant manhole cover that's been stolen, the injury is, tripping over tree roots. But that happens in footpaths all over the world. Tree roots grow everywhere. So, it's often down to stepping on something that's a little bit wonky or not straight, and you fall over on your ankle. The problem with the ankle is if you've injured it once, it's likely to repeat itself. So long term with ankle sprains, it's important to, I think, get it dealt with quickly. Make sure that you haven't fractured any bones, obviously, so seek professional help. But you can have it's a common issue with a runner and a cyclist who is coming off the bike and doing triathlons and all that sort of thing because of a misstep, and their body is used to cycling, for example, and then they get off the bike and then they start running, and at that point when the changeover, they're vulnerable to a little bit of a twist. So the best thing long term for an ankle sprain is to be strong around the ankle, and that's going to be the theme of my talk. What's the best treatment tonight? Be mobile and be strong. Next thing, this is where we get to the Achilles tendinopathy, and I've also put in here plantar fasciitis. Now, I'm not a podiatrist. I do deal with plantar fasciitis to a small degree, but sports podiatrists are much better at it than me, but I will talk about it tonight. And Achilles tendinopathy, pain develops either behind the foot behind the ankle or underneath the foot. Underneath the foot is the plantar fasciitis, but often we find If you have plantar fasciitis, you do have Achilles overload and the other way around. So they do seem to be connected with each other, and the tissue is continuous. So underneath the foot to the back of the ankle can be affected together. With the Achilles, it can be swollen, and you can see a little nodule, and the tendon itself can get quite thick. Often you would see one tendon thicker than the other. Now, looking behind your calf at the bottom of your Achilles is sometimes difficult to see and compare, but if you get your partner or a friend or a kid to look at your Achilles, they would be able to actually tell you one is much thicker than the other. And it's often painful first thing in the morning, both the Achilles and the foot, and they both should ease up after initially moving around. The reason it's often painful in the morning is sleep position and also not moving it very much. So a lot of the time people who have plantar fasciitis are tummy sleepers, and they sleep with their feet curled up. In other words, they shorten the plantar fascia tendon or the tissue. And when they wake up first thing in the morning, they immediately load it, and it's painful. The Achilles, because it's degenerating, the tendon is degenerated, especially the day after activity, you wake up and it can be very stiff to start moving around. And as your body starts to warm up and increases the blood flow, it can get a bit easier to handle. The Achilles tendon issues and plantar fascia are not as much, but they're often painful during the activity, but eases off once we warm up. With plantar fasciitis, it often actually gets worse as we go through the activity. So it's important to differentiate that. And again, with these two, seek professional advice, because the treatment and the management of these issues is to actually load them, not rest. So we like to help people control their pain and the inflammation, using an ice pack or anti-inflammatory cream, modify the sleep position if we can. To unload your Achilles tendon, sometimes people will give you a bit of a heel lift to put into your running shoe, just to unload it slightly. That's not a long-term fix, it just helps to ease it, to get you through it. And also looking at your running shoes. Are you in the right running shoe? For example, there's a Hoka running shoe, which is a very thick rocker sole, which can basically amend how you run in your running style. But most importantly for this and long-term release is to get strong and progress yourself through getting stronger. I'll mention this: back, neck, and shoulder issues. These are very, very important. As a chiropractor, we often see patients coming in with back pain that they've sustained during running. They often do it because they have a pre-existing injury in their back, they have poor technique, and they also have weakness in the muscles around the area. The neck and shoulder can have tension from squeezing the hands and lifting shoulders up, so we call that running tense. So that part of running technique is to run open-handed, or your thumb touching your baby finger, and running quite loose through the shoulder joints, so not running tense. The low back can be stressed from shearing forces, i.e. side-to-side forces of the weak pelvis. So in other words, your pelvis is falling sideways, and that puts a lot of pressure on your low back. Tight hips also can give us back issues because we're sitting at a desk all day. So we're not moving very much at our desk, and then we go for a run. So that's also important to be aware of that. And we can have also rib and shoulder blade pain. So that's rib at the back from our trunk rotation. So when we're running and our upper body is rotating too much. So generally a rule of thumb with running is with your arms, when they're pumping, they should not cross the midline of your chest. So you should not have your arms going across your body. So with the management of the back, neck, and shoulder issues, we talk about making sure they have proper running or good running technique, proper warm-up. So run your first kilometer a bit slower than you normally would, or make sure you're not going straight from your desk at your lunch break to a run, or getting out of bed and going straight for a run. Making sure people have proper and decent ergonomics at their desk. So when they're sitting at the desk, they're sitting properly, and then they are able to actually not be as tense and tight in the hip joints. And again, back to this horrible word, strength work, or horrible two words. Strength, strength, strength. I'll just mention the rest of the injuries that we see just to acknowledge them. But we can see shin splints in runner, which is quite common, which is pain at the front and inside of your shin. People who go too much too soon, and also especially as we go through menopause and our bone density decreases, especially if we have low body density or low bone density, we can get stress fractures, but anyone is susceptible to leg and foot stress fractures. Unfortunately, more common in females and more common in the distance running, but it can happen to anyone, so it's just important to bear that in mind. And again, seek professional help. And you can also get ankle impingement, which is repetitive pinching of the capsule of your ankle joint or a tendon at the front of your ankle joint from improper positioning. So again, it's a bit weak. Now, the general things with these is seek professional help, get a proper diagnosis, and go from there. So that's basically the quick run through the injuries. So hopefully I've covered everything that anyone hopefully has ever experienced, and hopefully you never have experienced an injury and never will, now that we've spoken a bit about it. But the 5 key tips that I'll give you to kind of start to finish up now would be, number 1, progression. Slow progression, the rule of 10% if we can. And I like to work with time. So I recommend to people start with 20-minute runs and progress yourself from walking and running. So mixing up walking and running. So maybe 2 minutes walking, 1 minute running for 20 minutes to eventually getting yourself to 2 minutes of running, 1 minute of walking, and then 3 minutes of running and 1 minute of walking, and then 4 and 1 minute, and 5 and 1 minute, and eventually running 20 minutes with no need to walk in between. So you've built yourself up to that strength position slowly, and then you progress your time by 10%. So 2 or 3 runs at 20 minutes, then you go 2 or 3 runs at 22 or 23 minutes, 24, 25, 26 minutes. So it's just a slow build up. You can use distance as well, but I like time. It's just neat and easy that way. 10 minutes out, 10 minutes back. The other thing we speak about with progression is as soon as when you start and you're walking and you're running, you don't go very far. But as you start to get fitter, you get stronger, you start to go further. So that's the other thing, is that in the beginning, 20 minutes may be 1 or 2 kilometers for you, but 20 minutes in the end can be 4 kilometers. You can run at 5 minutes a kilometer for certain times. You don't have to, all your runs don't have to be slow. Not all your runs have to be fast. And again, this is all relative to your position. If you're running 7-minute kilometers, fast for you would be 6:45. That's okay. It's all a relative thing. I think, again, that leads us to know your limits. If you feel today you're feeling tired and you feel like, oh, I don't feel like I can run very fast and I want to run 8 or 9-minute kilometers, that's okay too. Just go out and get your run done. But also know your limits. If your body feels tired, listen to it, because the last thing we want is to push through things and then you injure yourself. So I think it's very important to know how far you can push yourself. And that is the difference between an elite professional athlete, is that they know most of the time how far they can push themselves. And sometimes they would then go and push themselves even further. If you watch the Olympic triathlon, for example, the men, when he was on the line afterwards vomiting and actually had to be wheelchaired off the finish line, he tried his best on the course that day. So pick your battles. That's the other thing is, if you today feel a little bit fatigued and you've had a stressful day at work, just going out and having a walk or a slow run is better than nothing at all. But if you're feeling like your ankle and your Achilles is sore and you start to run and it's a bit sore and it's not getting better, as I said, pick your battles. You can run another day. Training through these injuries in the long term is going to give you injuries and you're going to break down. Where if you act wisely now, yes, you may not get your mileage up this week or next week, but you'll be able to sustain your exercise and your success further. And that's the key here, is you want to have long-term success. Again, the theme of my talk, get strong. Whether it's getting strong in the quads or hamstrings, identify where you've got a deficiency. And I'll talk about myself. I unfortunately did a duathlon a year ago in July, and I got a hamstring tendinopathy, and I still feel it to this day. But I'm trying to make my very weak hamstring strong. Unfortunately, I've got very strong thighs and quads. I cycle a lot, but also run a lot. And the two of those in combination with my weak hamstrings has just given me hamstring problems. So the way I can work on that is to just try and make my hamstring stronger and not give up on that. And as a chiropractor, my most important rule is stay mobile. And running is a perfect tool to stay mobile. It helps your cardiovascular health. It helps your mental health. In this day and age, with the beautiful weather outside in Sydney, but lockdown and gyms are closed, what's better and being able to strap on a $200 pair of shoes, that's the only cost that you have with running. It's beautiful. You can go out and you can have a brilliant workout in 20 minutes. You can have a brilliant workout in 30 or 40 minutes too if you've got the time. So it's just a matter of picking your battles and understanding what you've got available to you in time. You can get a really good workout for a 15-minute high intensity, or run 2 slow kilometers and 1 really fast kilometer for yourself, and then warm down. So on that note, we're going to just give an extra quick side note. Stretching versus warming up. Now, stretching is not a warm-up. Stretching, while it has benefit in some instances to keep us mobile and get us to change our position, and if we're sitting too long at our desks, it feels good to stretch muscles, we don't traditionally stretch before athletic endeavor. We certainly suggest warming up, increasing the blood flow to the relevant muscles. And with running, if it's first thing in the morning, that could be the first kilometer should be done slow. First 5, 6, 7 minutes should be done at a slow pace. Give the muscles time to warm up, switch on, and then you basically can go from there. If you do really want to stretch, and as I said, part of staying mobile, do it later in the day. Certainly do it after your run. Incorporate stretching as part of your warm down, but certainly I would not be doing it as a warm up or a injury management process. And in fact, if I had limited time, which most of us do, and we had to pick stretching versus strengthening, strengthening wins all the way, 100% of the time with all injuries that we see. Yeah, failing that, and you don't have a proper desk or access to a desk, just get one of these treadmill desks for your home setup at home. But on that note, I'll leave it to the floor. If there's any questions, I'll stop sharing my screen now. I hope that gave you some insight into injuries. There we go. How do I stop it now? Oh, there we go.
That was fantastic. Thank you, Greg. So interesting. I learned a lot. Yes, thanks very much. For anyone on the call, if you would like to pop a question in the chat, or if you're feeling brave, just unmute yourselves and you're welcome to chat. Ask your questions out loud. I'll kick off, Greg, because I was interested to hear what you spoke about back and upper back and neck. So I did a particularly long run today, and I have noticed it increasingly that, I just never expected to have a sore neck as a result of a long run. And it just seems to sort of hit me here at the base of where my neck joins my shoulders. I take on board everything you said about form and efficiency and sitting well during the day, but is that generally it, or is there something else I should be doing, or any pointers for me?
So look, with regards again to any injury, without assessing you, it's difficult to know exactly where your issues lie. But generally, for most of the part, we carry our heads forward and we hunch forward and over. So our shoulders are a bit round, whether we're reaching for a keyboard or our device, our phone. So we're tending to be looking forward and down. And then when you translate that to running, that's a similar sort of posture as well. Especially a lot of the textbooks teach you to kind of fall forward and run. So the shoulders tend to be rounded. You're putting pressure down. You're also looking down, hopefully at the pavement in front of you, making sure that you don't run into any obstructions or anything like that. So all of that could lead to furthering of your neck stiffness, especially with a longer run. Now, the reason that happens is because your muscles fatigue. So they're holding you in this position. They're able to hold you in that position, but they can only hold you in this position for so long before they then start to give out. And then we start to use other muscles, and the joints then start to get loaded, and we start to get a bit of discomfort. And that's our body's way of giving us feedback. So just a couple of tips and tricks, I suppose. When you running, do not pull fist and do not let your shoulders rise up. Try and, as I said, run relaxed, finger and index finger or ring finger to your thumb, and almost running with your hands like that. If you see some of the top professionals, their hands sometimes just like hanging limply in front of them. Certainly not crossing your body. That's a very important thing. Again, puts a lot of traction, and your neck's not turning, but your lower body is, so it puts a lot of pressure on. And what you'll see a lot of the athletes also doing, and you've got to be very careful with this with balance, but they sometimes would look back at some point Now, that has been linked to some people obviously losing their balance. And I would, again, put a disclaimer, especially if you've got bone density issues or you're running on an uneven footpath. You do that and you fall and you can break bones. So just be careful when you do that. But just changing your posture. The other thing is stop. If you get to a traffic light, stop, just do a quick stretch. So just changing your position and your posture. And that's a lot of the time where you can get a bit of value out of stretching, which is just to kind of open up. If your chest is very tight, that'll put pressure on your neck. So I hope that answered it without like assessing.
That's really helpful. Thank you. Very valuable. I can see a question has come through in the chat from Lee, who's asking, after a long run, is it better to have a hot bath with Epsom salts or use an ice pack and elevation?
That's a very good question, and I don't know the answer to that. The research is actually quite mixed. If you look at professional athletes, especially like rugby players and who do contact sports, they actually do what they call contrast bathing, which is hot and cold. Yep. They go and get into ice baths, and then they go and get into warm after that. Look, I think I don't see any problem with having hot bath with Epsom salts. That's relaxing, and Epsom salts, in theory, can help push magnesium into your muscles, which, especially if it's hot, you would have used magnesium and you can start to get muscle cramps and all that sort of thing. The ice pack, I don't think necessarily using an ice pack unless you've got an actual injury. So certainly if you've got a sore Achilles, for example, or a sore foot, I would use an ice pack on that injury. But to be honest with you, I'd probably, if I don't have an injury, I would go the hot bath route. If I have an injury, I would go the ice pack, and then I would go the hot bath immediately afterwards, or hot shower. So then you get that contrast to the injury. Hope that answered your question.
That's awesome. Shireen is asking whether you have any tips for running with arthritis in your feet.
Yeah, well, look, a proper assessment, probably to a podiatrist. We do treat, if you've got arthritis, in other words, a stiff joint, and it's not moving very well, then what we can do is promote movement and also promote strength within the foot, the deep, what we call the intrinsic muscles of the foot. The other thing is, if you've got ligament from the arthritis, so in other words, your toes are a little bit wonky, you probably should go and see a podiatrist who understands running and running injuries, and they could possibly make an orthotic, or they could advise you on a proper running shoe. But in general advice, I would suggest, again, do what you can. So for example, if you can run 8-minute kilometers or 9-minute kilometers, and you can run 2 kilometers, and that's 20 minutes, and it's not too painful, then that's good enough. And you can slowly build yourself up to that point. Because like I said, the loss of body weight, so in other words, taking a little bit of load away from that arthritis, is going to be far greater than the load that you're putting through by running. And also, again, the cardiovascular and mental health benefits of running are immeasurable in comparison. So I think as long as it's not debilitating, that's what I would do. And the thing is, if you run and then you can't walk for the next 3 days afterwards, then that's probably not a good sign. But if you run and you're a bit sore the day afterwards, that's relatively normal and something we can handle. Again, as long as you can get out of bed and walk around the next day, that's a key thing to me, is measuring your progression.
Yep. I happen to know Shireen, and she's actually a very talented runner. She's actually really fast and very, very slender. So, but she's struggled with that arthritis for a while, and it does cause her pain both during and after the run. So I will take on board what you said about, an expert podiatrist opinion.
Yeah, there's a couple of really good ones that understand athletes actually in and around St. Ives that I know, so I can kind of give you their details. And sometimes even just strapping, buying a tape and learning how to strap your own foot before you run to support things. I mean, if you look at most of the athletes, they, especially contact sports like rugby union and league, they would all be, and AFL, they'll all be strapped up big time. The key here is, does that strapping do anything? Well, it just helps them initially, if it helps to activate the right muscles and give you movement. But I, again, would say move. So with arthritis, it's a stiffening up process. So maintaining normal in-plane movement is important. So if you don't get movement where you're supposed to, then other things then have to move too much to overload, and then they get overloaded themselves. And that's often where the people feel the pain from. So, I ride with a guy who he was supposed to actually go for a knee operation not too long ago. He's one of the strongest cyclists I know. He leaves me for gas on the hills. He's unbelievable, and he's due to go for an op. And I'm like, and he's got severe knee arthritis with impingement. His surgeons are trying to do everything to prevent him from getting a knee replacement. But this guy rode 260 kilometers in the past week, and not very slow. So, is this arthritis really holding him back? Well, it's causing him pain and discomfort, but it's clearly not affecting his performance. I mean, maybe he could have ridden 500 kilometers, but you got to also set your limits.
Quite right. Oh, that's fascinating. Okay, I think we've got time for one more. I saw a question from Robin, wondering whether running every day is too much if you are nursing an injury. I know you've already touched on this, but is there anything else you'd like to say?
Well, yeah, so we did touch on that. I mean, basically, look, if you are able to run every day and you progress yourself to that point, I don't mind it. I generally, personally, I don't like to run 2 days in a row. I know for me, every time I do, I then put too much load through my body and then I start to get injured. So I like to run one day, cycle the next. Saying that, if I'm used to running every day, and I know I've got a lot of patients that run between 60 and 150 kilometers a week, and they run every day and then not injured. They do ultra marathons and all that sort of thing. So I think it's, again, depending on where your level's at and listening to your body. The key is, if you're injured, then you need to address your injury. And if the running is causing your injury and perpetuating your injury, you need to change what's causing that and get that dealt with. But if you can run and you're not in pain from running every day, then I see no issue with it at all. Again, the benefits far outweigh the risks, in my opinion.
100%. I couldn't agree more.
Can I just say, I think I saw a message about sharing the details. If anyone wants, just contact me at my email address, and I will arrange. Just let me know where you are. So, for example, the podiatrist that they have a practice in St. Ives, I'll touch base with them. I think they may even be in Gordon, and I'll just touch base with them and find out their details. But if anyone wants information, just feel free to contact me afterwards, or any questions that were not answered.
Yep. Greg, that was really, really informative and very valuable. I'm really grateful to you for your time and for your knowledge. I think we all learned a lot. Running has been such an avenue for so many things, as I said earlier, for friendship and joy and personal achievement, but also in instances like this, it's been a real avenue for learning. So very, very grateful to you for your generosity. And thank you very much, everybody who's on the call. Just a quick reminder that if you'd like to join us next week, Robin, who I can see over there, will be taking us through a session on Pilates for runners. We've heard tonight how important strength is. Pilates is one of the avenues that we have for getting stronger and making sure we remain mobile. And then looking ahead, there will also be sessions on running as we approach menopause, running and the importance of sleep, and also a session on shoes. So watch out for details on all of those, which will be on our social channels. And until then, genuine thanks once again, and have a great evening. See you at the next one.